Hypoglycemia can be dangerous, so it must be treated right away. If a child's blood glucose result is less than 70, a caregiver will need to act immediately to correct it. If the child uses a continuous glucomonitor, more commonly called a CGM, for their blood glucose monitoring, the caregiver will instead need to use a blood glucose meter to check the child's finger for the duration of the low blood glucose and until a blood glucose level higher than 70 is reached. A blood glucose meter is the most reliable method for checking blood glucose, and during an episode of hypoglycemia, it's important to be able to check the blood glucose results quickly and accurately. To treat hypoglycemia, we advise following the Rule of 15. Give the child 15 grams of fast-acting carbohydrate like glucose tablets or gel, 4 ounces of fruit juice or soda, a tablespoon of honey, sugar, or a small amount of candy. Avoid chocolate and try to stick to fruit or sugar-flavored candies. Recheck the child's blood glucose after 15 minutes. Repeat the steps until the child's blood glucose is higher than 70. Remember, you should not give insulin when you are correcting a child's low blood glucose. A low blood glucose can happen at any time, so it's important for a child with T1D to always carry a blood glucose meter and a source of fast-acting carbs like glucose tablets in case a low blood glucose needs to be treated. Severe hypoglycemia can lead to seizures and even death. If a child's blood glucose is less than 50, it is considered severe hypoglycemia. If they are experiencing severe hypoglycemia, you will need to give more carbs to correct the blood glucose. The caregiver should follow the same steps as the Rule of 15, but you should give the child 30 grams of fast-acting carbohydrate until the blood glucose is above 50 milligrams DL. After the blood glucose has risen to at least 50, you can follow the Rule of 15 as normal. You should still check the child's blood glucose every 15 minutes until it is above 70 and in the target range. If a child with T1D becomes unresponsive by falling unconscious or begins having seizures due to hypoglycemia, a caregiver will need to administer a special medicine called Glucagon to raise their blood glucose quickly. The child with T1D will not be able to do this for themselves, so it is important for everyone who is responsible for them to know how to do this. There are several different types of Glucagon available. Please visit our website for more information on how to deliver different types of Glucagon. Over time, the steps to correct a low blood glucose will become more familiar, and the child may be able to recognize the symptoms of a low faster to seek treatment before it becomes serious. In the next video, we'll discuss some brief tips for handling potential low blood glucose overnight.